guys, it's me. Long time no see. I know y'all have been begging me for videos, begging me to come back to YouTube, and I'm so sorry it's taking me so long to make a video. It's just that I have been so busy, like beyond busy. And if you follow me on Instagram, you know that I've been traveling a lot and still working. So it's been a lot of like back and forth, and I just haven't really had the time to sit down and make a video. And also it's like a lot on me to like make a video, edit it, and continue to do that because I am working full time, I am traveling, and also I am like in the middle of starting my own business, which is a secret for now, but I'll keep you guys updated on that too. So it's just been a lot, but I love you guys so much. I really appreciate the support. So I'm like, let me finally, like, I just got my hair done. Let me just sit down and make a little video and kind of like tell you guys what's been going on. So I know a lot of you want to know about like how I travel and work full time still. Like a lot of you have questions about that. In the nursing field, I know a lot of people have questions about like how I have red hair and go to work. I know you guys have like tons of questions, and I am going to address all of that stuff, but in a separate video. This video, I really want it to be about one specific topic because I feel like that it's very interesting, and I haven't really opened up about it because I was on the fence, but I think it's been an appropriate amount of time that's passed since this thing has happened, so I'm ready to spill the beans. So back in June, my birthday is June 22nd, so I turned 25 this year. So back in June, on June 20th, I did test positive for COVID-19, and it was literally the worst time for that to have happened. I planned this big extravagant birthday party for my 25th birthday. I don't know about y'all, but like I'm really into birthdays. Like I love birthdays. I just feel like your birthday is the one time out the year where you can do whatever you want, and everybody should just be like singing your praises, and it's just your time, your moment. And so big birthdays like 18, 21, 23, 25, 30, like those years are like really important, and I just think that they should be celebrated to the fullest. So it was my 25th birthday. I had these big plans. I rented this like huge house in Miami, a yacht. All my friends were coming. It was gonna be like 15 to 20 of us. We were gonna be deep. It was gonna be so much fun. Like I had got all these, like I got dresses made, outfits. Like I had just like planned on having the best 25th birthday, and I was really excited about it. And then I got COVID. I have been working the whole pandemic, obviously, because I'm a nurse. So I have been working in a hospital. I wasn't working overtime, so I usually do work overtime while I used to. But when COVID started, our hospital actually became really short on patients. Like our census dropped dramatically. And I'm not sure if it was just because people didn't want to be in a hospital because they were scared of getting COVID. People were actually trying to quarantine. So our census was really low. So they were calling a lot of the nurses off. So there were no overtime. For maybe like a month and a half or 2 months, I was getting called off. Like I wouldn't even get my 40 hours for that week. I would have to use PTO in order to still get my like regular salary or regular pay. So it was tough, and I wasn't really working that much, but I was going to work, and we do have to wear masks the whole 12 hours that we're at work. I haven't even seen my parents in months. It's been a while because my parents are old, and I just don't want to like put them at jeopardy or put them at risk. I haven't seen my parents, and I have been, just like at work for the most part. So mind you, I had COVID in June, so things were a lot different than they are now. This was like the height of quarantine when everybody had to stay in the house, everything was closed, so it was a little bit different. I was really quarantining for the most part. I wasn't traveling. Only time that I was outside would be to go to work or to go to the grocery store. So okay, you know what, that's not entirely true actually, because towards by the time June got here, they did start to open stuff up. So yes, I was like, you know, parlaying a little bit. I did go to like a couple of strip clubs and hookah lounges and stuff at that time. But that is not how I got COVID-19. I'm pretty sure that's not how I got COVID-19. So on June 7th, I went upstairs to my pool with my friend, and we were chilling at the pool, like having a good time. And we were congregating with other like residents of the building, ordering food, drinking, just having a good time, listening to music at the pool. So the pool was open at this time. So basically, I did get COVID when I was at the pool. I'm sure of it because after I tested positive, about 20 other people in my building tested positive for COVID, and nobody at my job at the time on the unit I worked on tested positive for COVID. So come on, like if I got it from somewhere, it was from the pool, you know, at my apartment. 2 days after I was at the pool, I got a message saying that somebody who I was with at the pool, like, you know, one of the residents had tested positive for COVID. And so I'm like, wow, that's crazy, you know, but I had felt fine. I'm like, you know what? I'm gonna just go get tested because I have to work with people who are vulnerable, you know, at work, really sick and immunocompromised, and I didn't want to put anybody at risk. So I was literally at work when I started having a cough. And I went to the administration and I just told them like, hey, somebody tested positive while I was around. I do have a bit of a cough. Like, you know, I think I should get tested. So I asked them if they can test me there at the hospital because I didn't want to leave work at the time, even though I always want to leave. But I mean, I didn't want to leave. I was fine. Like, I wanted to finish out my shift. But I did have that cough and I didn't want to be ignorant and ignore it. So they sent me home and they was like, oh, okay, just go get tested tomorrow and wait for your quarantine until your results come back. So mind you, I just had that cough. Like, that's it, just like a little cough. I didn't have any chest pain. I didn't have a fever. And I felt fine. Like, everything about my body felt okay. So I highly doubted that I had COVID. I'm like, I don't have COVID. Mind you, at this point, what was it? Okay, it was like June 13th-ish. I got tested on the 14th. So I'm like, okay, my birthday's coming up. Like, you know, I'm just gonna get tested real quick, but I still gotta get ready for my birthday. So I went and got tested on the 14th. And then I was quarantining and I'm in the house bored, not doing nothing. And I'm still like setting stuff up for my birthday. I'm like still texting my friends, like, you know, like y'all got y'all flights, y'all ready.
Who's next? Who's next?
So then on June 20th, I got a call from the doctor. Let me tell y'all about the testing process. So I went to urgent care. It was affiliated with the company that I work for. And I went back and they did a swab, and it was the swab that goes all the way up to like right about here. And they swabbed each nair. It was really deep. The girl literally like stuck it in there and she left it there for 10 seconds, pulled it out, and then did the other one, left it in there for 10 seconds and pulled it out. Very much uncomfortable, like very much. I wouldn't call it painful. It didn't like hurt me, but it was just like, you could feel it. Like, you can feel how high up it was, and it was uncomfortable. Like, I was like this the whole time. And when she pulled it out, it was like, ugh. And then they sent that to the lab. When I went to urgent care, I told the doctor that, I'm like, you know, I think my lung sounds are diminished. He listened to my lung sounds. He's like, oh, you sound fine. You sound good. And he's telling me, he's like, I doubt it's COVID. I think you're fine, but we're going to send the test out anyway. You should be fine. So, of course, like, even though I'm a nurse and I know how, like, the medical field works, I'm still a human at the end of the day, and I get anxious just like everyone else. So to have a doctor tell you, like, I don't think it's that, and, you know, it's probably nothing, you gotta get this sense of relief. So I was like, I ain't got it. Like, the doctor said I ain't got it, so I probably don't got it. So when he called me on the 20th and was like, yeah, apparently your test results came back positive, I was literally like, what? You told me I was okay. And it's like, I was so annoyed. Like, literally, like, my whole heart just dropped to the ground. I was so sad. I was so distraught. And then I called my mom and I'm crying. I'm like, Mommy, I got COVID. It's positive. I can't believe this is happening. And she's just like, oh my God. She freaking out. She's like, are you okay? Like, and I'm just like, no, I'm not okay. I'm like so upset. So at this time, I still feel okay. Y'all, I promise y'all. Maybe like an hour later, all of a sudden I started feeling sick. And it's a mental thing. It really is a mental thing. Because that whole time I was quarantined, it took 4 days for them. Okay, wait. My dates are not adding up. I don't really remember because I got tested on a Monday and they called me on Friday and told me my results were positive. So that whole time from Monday to Friday, I was fine. I didn't have no symptoms. Did have that cough, but I started taking Theraflu. And I was taking it like every 4 hours as needed. And I kind of did need to take it every 4 hours. So my cough was suppressed, so I didn't have any symptoms that whole time that I was waiting. I started feeling real high. I started feeling really short of breath. I started having chest pain, and my cough was just like coming back, and all of it. I had a really bad headache, and it was just a lot. That night, I lost my sense of taste and smell, and that's when I knew I was like, okay, this is serious. Like, I really can't taste and smell nothing. And if y'all know me, y'all know I love to eat. So I was literally depressed. I'm like, I can't taste my food. I didn't want to eat. It was just like, it was really hard. So having COVID, and then also I live in Houston and I live in this state by myself because I'm from Chicago. So my family's not here. My sister was living in Houston at the time. But that was it. And so it's like I didn't have nobody to kind of depend on. Even though I had to be in the house by myself and I had to quarantine by myself, it's not like somebody could come and keep me company. Still, I feel like that, like just knowing that you're in a state by yourself with a disease that's blasted all in the news, like saying that it's killing people, and, you know, knowing the effects that it has on the body and, you know, everything, I just felt really anxious and I started to kind of freak out. And then also, it was my birthday and I was just kind of like, what is life at this point? Like, I was like freaking out. So I think that that's kind of what started putting my body under stress, that like mentally I started kind of losing it. So it is hard to quarantine by yourself when you are sick, because, you know, when you're sick, you already kind of feel like blah, like you don't want to do nothing, and, you know, you want somebody to make you soup, or, you know, like do this for you. You want people to do stuff for you because you just feel like tired and you don't feel like doing much, and it helps. So having COVID and then knowing that nobody can help you and it's just you by yourself, it's really stressful. So I did deal with some anxiety when I had COVID, really, really bad anxiety. So after I got my diagnosis, the next day I started having really bad chest pain and really bad shortness of breath, where I couldn't even like stand up, and I was like in the shower and I started like, I felt like I couldn't catch my breath. Like, I was like showering like normal. I was washing my hair and I just like had to literally stop, and I like sat on the floor of the shower because I couldn't breathe. It felt like my lungs were like not expanding all the way. So like your lungs should be opening when you're breathing, like opening and closing, inflating and deflating. And it felt like when I tried to take a deep breath, like that, it felt like my lungs wouldn't open all the way. It just felt like they were open just a little bit, and then like I couldn't get that full breath out. And so when you feel like that, it's mental, because then I start to feel like, oh my God, I can't breathe. Like, I can't breathe. I'm in the house by myself. Like, I'm about to pass out. Nobody's here. I'm going to die alone. Like, that's all I was thinking. So it was very much like a lot to handle, and like mentally, and I was like stressed out. I was freaking out. So at this point, I started to monitor my symptoms. I have my own little pulse ox monitor that I would take check my oxygen levels, and like a thermometer. I still never got a fever. The whole time I had COVID, I never had a fever. but my oxygen levels did start to drop. So you want to see your oxygen between 95 and 100%. Me, I'm a healthy young adult. My oxygen is always 100%. It's never low. I don't smoke. So my lungs are, they're not scarred. So my oxygen is usually always at 100%. And I was checking my oxygen and I'm like 94%, which 94% is not bad. But just knowing like when you're healthy and then you're usually at 100 and that you have a disease that affects the lungs directly, I was freaking out about that. I'm like, oh my God, I'm not getting enough oxygenation. Like, it was a lot. So, and then the shortness of breath was serious. Like, I couldn't really do much. My apartment is not big. Like, and it would take so much of me to get out of the bed into the living room, like, without, like, being, like really, like, losing my breath and having to overcompensate. So I called the urgent care that I got tested at and told them, because I knew what I needed. I needed an inhaler, like a rescue inhaler to help me to catch my breath. Because I'm a nurse. I knew exactly what I needed to be done. So I called them and I'm like, yeah, I'm starting to have chest pain and shortness of breath. And I still had a cough. And they're like, okay, I'm like, I need an inhaler. Is there any way that I can come in and get a prescription for an inhaler? So first they said yes. So I drove up there, which was a lot. It was so much for me to get in the car. If it was already a lot for me to get from the bed to the couch, you can imagine how hard it was for me to get from the couch all the way to the car and then drive to this clinic. So that was a lot. And I got there and they wouldn't let me come in because I was already positive. And so the nurse practitioner, she calls me while I'm in the car and she's like, I can't see you because your symptoms are getting worse. And, it can be really bad. So you need to go to the emergency room and get a chest x-ray and get some arterial blood gases. I'm texting my friend, the rapid response nurse at my job. And I'm like, listen, I don't know what to do. Like, who's the ER doctor? Because I knew that if I went to a regular emergency room and told them that I tested positive for COVID and that I was having chest pain, I knew that they were going to want to admit me because that's a really bad sign, chest pain, especially with COVID. So they might want to monitor you closely for, at least 24 hours. And at this time, they were admitting everybody with COVID, like with symptoms, because it was literally affecting people differently, young and old, even if you didn't have any, prior health conditions. So I decided to go to my job, my hospital emergency room, because I knew the staff there and I just thought like, okay, I'll be able to go in, get what I need. And it was a positive experience. Because I worked there probably, I got in, I didn't wait for anything. I like instantly went to the back, got my IV, got EKG, chest x-ray, saw the doctor. Like I was like monitored super close. My friends, like the staff members that I know, they were there like waiting on me hand and foot. It was really reassuring. It made me feel better that I was around people that, that knew me and that I knew and like that they were gonna make sure that I was okay. So I went to the hospital. I didn't get admitted because I already had told them like I'm not staying here. Like I didn't want to be admitted in the hospital. I just needed an inhaler. So they monitored me. My oxygen was a little bit low, and then like whenever I would be talking to like the nurse and the doctor, my oxygen would start to drop. But if I was just resting, it would be like 98%, but it did drop to like 92. My blood pressure is usually always like 112, 113. It's usually always really good. My blood pressure was like 148 systolically, and my heart rate was probably like 89. Probably the worst thing about like my vitals was my oxygen saturation, because it was dropping a little bit, which is expected. And then they did a chest x-ray that showed infiltrates consistent with COVID, and also arterial blood gas, which is blood that comes from an artery. That hurts so bad, I promise y'all. And then like the respiratory therapist, he missed the first time, he had to do it again. I was screaming. It was so bad, like that really hurt. But my arterial blood gases, for the most part, they were okay. My PO2, I think, don't even give me the line, I don't remember the values, but they were a little bit off, but it was consistent with COVID. It was like respiratory distress, a little bit, not enough to have me admitted into the hospital. So I got an inhaler, and they also gave me some antibiotics, and they discharged me. I went home, and instantly the inhaler helped me catch my breath. It made me feel better. I started taking the antibiotics. The life of COVID-19 video, because I'm extra and I don't have nothing else to do. So, what's up with you guys? Those specific antibiotics can, throw off the good bacteria in your body. So I was taking probiotics at the same time, and I started to feel better probably the next day. So before I started taking the antibiotics and before I had the inhaler, I definitely had chest pain, shortness of breath, and a cough. And then I had a regimen, and I took Theraflu, the daytime one. I took that every 4 hours on the dot during the daytime. I took my antibiotics, which was azithromycin. I took my probiotics, and I took Claritin, and I took vitamin C tablet, and I drank an emergency. And then at night, I would do the same thing, except, I would only take all those drugs once a day, except I would take the Theraflu nighttime at night. And yeah, I always kind of slept up, prompted up, because I was scared to lay flat, because it made it harder for me to catch my breath once I got up. So I kind of stayed prompted on pillows while I was sleeping for a couple of days. And then after the next day after I started taking the antibiotics, I started to feel better. Because I don't think that everybody was getting discharged with azithromycin. I'm not sure, but I know other people who had COVID as well, and they weren't on any antibiotics. Their doctors just told them stay home and quarantine. So, but that azithromycin definitely did help. Even though azithromycin is an antibiotic and not an antiviral, and COVID is a viral infection, I did feel like that it helped. So apparently azithromycin has antiviral properties. So, I mean, that's what they say. So, anyways, took that. I started feeling better. My cough was the last thing to go away. God, I didn't have my taste and my smell for 2 days, 2 to 3 days. After that, third day, I started to be able to taste and smell. I was so happy because I was not able to eat, just not feeling like I didn't want to eat because I couldn't taste nothing. I was just eating soup, and it was so depressing. Come on, I'm hungry. Y'all know I like to eat. But I got my taste and smell back in 3 days, thank God. And then I started to feel better after I had my inhaler and everything. And then I probably lost my cough 2 days before my quarantine was over. I just didn't have a cough anymore. So I was blessed. I was so blessed that I got better quickly. Being on quarantine for 14 days was definitely hard. I was on quarantine for the whole 14 days. So with my job, they did, I did have a paid leave because I was sick with corona. So I was paid for that 14 days. I think I didn't go to work for 2 days after, just to kind of catch up and celebrate my birthday. But I was fine. So I felt better immediately after I had the antibiotics and the inhaler. So when I was off on paid leave, I did have to download this app that monitored my symptoms every day. I would have to log on and report whatever symptoms I had, if they were getting worse or better. And it was kind of I think it was some type of online nurse that would look at whatever I put in, and if something was getting worse, she would reach out and say, oh, maybe you should call your doctor, or you should do this, or just kind of giving recommendations, kind of home health in a way. And so that was fine. I mean, I don't have to tell you guys COVID is real. Everybody knows COVID is real. At this point, if you haven't had it, you know someone who's had it and recovered, or, unfortunately didn't. But I do feel like that if you are healthy without any prior medical conditions, and you take care of yourself, and you do take that time to quarantine and stay home and rest and take, these whatever supportive medications you can, and drink lots of fluids, that I think that you should recover and be okay. Me personally, I don't have any residual symptoms from COVID. So I haven't used the inhaler since I was on quarantine. I still have it, but I haven't used it at all. I still take vitamin C, and I don't get short of breath. I don't have any chest pain, nothing. Like, after I got better, and that was it. When I was in high school, like around the ages of 14, 15, I did have asthma. So I was a little concerned that, you know, my lungs would maybe have some scarring from back then, but I haven't used an inhaler since when I was in high school. Like, I had one, and I'm gonna be honest with y'all, I'm pretty sure I maybe have made that asthma up because I didn't want to like do gym, because I was so over school at this time when I was like 14, 15, and I didn't want to participate in gym. Like, they was making us run around and do all type of stuff. And I remember like telling my mom, like, I just feel like so tired. And so she took me to the doctor, and they was like, oh yeah, you have like asthma and acute bronchitis. And I got out of gym, and I remember like that was kind of like what it was. So I'm not sure if it was true asthma. The doctor did tell me I had asthma, but there's no real way. At least they didn't do any real diagnostic tests to tell me I had asthma. She listened to my lung sounds, and I probably did have some bronchitis at the time. Because after that, I never used an inhaler. Like, I don't even remember really using it for gym. Like, so it kind of took me a while to want to talk about having COVID, because I feel like I'm going to get a lot of backlash because I have been traveling. So I just feel like I did do my 14-day quarantine. I wasn't around anyone. I stayed, my distance. I haven't had any symptoms since. I've never had a fever. I haven't had any cough since. I haven't had any chest pain, shortness of breath. If I had any symptoms or if I felt sick, I would not go outside. Trying to see that I feel sick at all. I felt great. Like, I do feel like that having COVID did boost my immune system after my body had a chance to kind of like, fight the virus. So now I do feel like that my immune system is a little bit stronger than maybe someone who hasn't had COVID yet. And I haven't been sick at all. I haven't had any type of symptoms of any flu even or cold or nothing. I've been just fine. So, yeah, that's that. And I just felt like now, it's been months since this was back in June when I had COVID. So I feel like, okay, I could talk about it. Like, it's been long enough for me to know if I've had any residual symptoms or, anything like that. There's only so much that you can do as an individual. Like I said, I do not directly go around anyone that is immunocompromised, and except the times that I'm at work. And when I'm at work, I always have a mask on. I'm always washing my hands, and that's out of my control. It's nothing I can do. I'm a nurse. I have to be, on the front lines. There are several nurses that have tested positive for COVID and that are still working. And there are nurses who didn't even do their 14 days because their jobs have told them to come back. You are at risk for getting COVID just from stepping outside. So, I don't feel like obviously you're more at risk when you're in bigger crowds or, because you don't know who other people are around. But you still take that risk every time you go outside. And it's just, as long as they got outside open, people are going to be outside. I'm outside, and I take the precautions that I feel like are needed when I'm outside. And I take my, daily supplements, and I watch out for my own symptoms if I have symptoms so I can know to isolate myself. Yeah, and that's that. So definitely everybody should be careful and take whatever measures that they need to take to protect themselves. Okay, guys, thank you guys so much for tuning in. I really appreciate all the love and support you guys give me. I'm gonna try harder to make videos and edit them. I'm trying to work on finding somebody to edit my videos for me so that all I have to do is sit here and talk, because I can do that all day. It's really just getting on the laptop and editing my videos and just consistently doing it. That it's kind of a lot. Like I said, I am working on a business right now, so it's hard for me to, get that content out. But I really appreciate you guys, and I'm going to try harder to get it out. Thank you guys so much for watching this video. Don't forget to like and subscribe. Let me know what you guys want to hear next. I think I'm going to have to end up doing something about traveling because, like, that's what you guys, I think, want to hear the most. It's like, how do I travel and, like, be a nurse at the same time? So I'm going to try to make that video, like, in a couple of days and edit it and post it. So thank you guys so much. Don't forget to subscribe, like this video.